What bothered me about my hair loss is that it was making me look older. You know, I'm a young guy. I'm in my early 30s, and you know, losing that hair kind of makes you look like you're older. You lose a little confidence.
For starters, okay, we know we're going to fill in all these areas right here. I do not need to shave anything. We're going to do as many grafts as necessary in the area. We use the same little instrument, same medicine that we use when we go to the dentist.
I decided to undergo a hair transplant so I can look more presentable, be more confident when I'm approaching people. For years I played football, so I wore a helmet, and I would always blame it on the helmet. Yeah, my hair's thinning because I'm wearing a helmet. But you know, I recently retired, and I'm kind of realizing that it's not because of the helmet. It's, you know, I'm losing my hair, and I'm excited about doing something about it. My wife and I did extensive research on this, and we found out that Dr. Charles is by far the best. You know, he's a great artist, does a great job with the transplants.
What made me go into hair transplantation was back when I was in my residency doing radiology. I had a dinner with a friend of the family who was a big hair transplant doctor in the Detroit area. I had some elective time coming up, and he decided to invite me to come visit his surgeries and observe, and I found it very interesting. I had an opportunity to do two things I'm very passionate about. One was medicine and the other was art, and this allowed me to combine both those things in my life into one career. I've been performing hair transplantation for 16 years now. I started right after my residency, and I've been doing predominantly hair transplants for the past 16 years.
Prior to meeting with Dr. Charles, I did not know about the artist. I had all kinds of preconceived notions on what it was like to get your hair transplanted, and coming and speak to Dr. Charles, he showed me what the artist does, how accurate it is, the small incisions that it makes, and it got me very excited about getting the procedure done.
The artist is a new FUE device that is robotic and assists the doctor in performing the FUE procedure. It's much more high-tech than any of the existing FUE techniques that are available right now, and it's fully automated and adjustable, so it just assists the doctor and has allowed us to do the FUE procedure with extreme accuracy. The time it takes to do an artist procedure varies depending upon the difficulty of the case, the number of grafts we're trying to obtain for that patient, but generally it's a full day procedure and might take a little bit longer than the standard FUT or traditional strip procedure. I recommended the artist procedure for Erik because he already wore a very short hairstyle and had his main concern was not having the linear scar in the donor area, and this allows us to get hair from the donor, let it heal up, and not have it be visible, and have the patient still be allowed to wear a very short hairstyle.
You know, post-football, I'm opening up a medical clinic. I'm going to be the face of the clinic, and I would like to be very confident when I speak to patients, future clients, and just overall, just want to feel good about myself.